Have you ever heard the statistic that more than 30 million men in the United States experience some form of erectile dysfunction? According to the Urology Care Foundation, this is a real and growing issue, and it can be incredibly frustrating if you've already tried popular erectile dysfunction pills like Sildenafil or Tadalafil, only to have them fall short. You might be thinking, is this really it? Should I just give up? The truth is, there are many reasons why your ED medication might not work the first time, and it doesn't mean that you're out of options. Today, let's take a deep dive into how these pills actually function, why they sometimes fail, and how you can get the best results before throwing in the towel. First, let's explore how these medications work in the body. When you're sexually aroused, your body releases nitric oxide, which sets off a chain reaction. Nitric oxide leads to the production of a chemical called cyclic guanosine monophosphate, often shortened to cGMP. That cGMP is what makes blood vessels in the penis relax and open wide, allowing blood to flood in. This creates and sustains an erection. However, in many men with ED, an enzyme called phosphodiesterase type 5, PDE5, breaks down cGMP way too quickly, causing the erection to fade or never fully form. Medications like Sildenafil, often known by the brand name Viagra, and Tadalafil, Cialis, are specifically designed to block PDE5 so that cGMP can do its job and keep those blood vessels open. That means more blood flow to the penis and a better chance of getting and maintaining an erection. But if you've tried them once or twice and haven't seen results, you're not alone. One of the most common mistakes is giving up too soon. Let's look at the science behind why repeated attempts can improve your results. Researchers examined more than 1,000 men in studies conducted between 1996 and 1998. These men tried sildenafil for their ED and recorded whether they could achieve intercourse successfully. On the very first try, only around 54% of participants reported success. By the second try, that number went up to 64%. And by the 8th attempt, success rates soared to approximately 86%. These numbers might seem surprising, but they highlight one simple truth: practice matters. The first time you attempt to use the medication, you may be anxious, you may not time the dose correctly, or you may still be stressed about performance. By the time you've taken it a few more times, you have a better handle on timing, dosage, and what you need to get in the mood. Why dosage matters. One big part of optimizing your experience with ED pills is making sure you're on the right dose. Often, primary care providers or online subscription services start men off on lower doses, maybe 25 or 50 milligrams of sildenafil, without explaining that higher doses, such as 100 milligrams, might be required. In one clinical review of 137 men who were referred to a urology practice for failed sildenafil treatment, over half had only been prescribed 50 milligrams. When specialists increased the dosage and taught them how to use it effectively, more than half of those men found success. This doesn't mean that higher doses are universally better for everyone. However, it highlights the need to make sure your prescription is appropriate for your individual needs. Your doctor can help you figure this out after discussing your medical history, current medications, and any risk factors. Taking it the right way, timing and technique. You might assume there's nothing to taking an ED pill, but popping it in your mouth with a sip of water. In reality, there are several key factors that determine whether that pill works for you. Number 1, sexual stimulation is still crucial. PDE5 inhibitors don't act like a magic wand that grants you an erection out of nowhere. You still need to feel aroused, whether that's from visual, tactile, emotional, or even aromatic cues that spark desire in your brain. This release of nitric oxide is what truly sets everything in motion. The pill just helps make that release more effective. Number 2, timing makes a world of difference. Ideally, take sildenafil or tadalafil 30 to 60 minutes before you expect to engage in sexual activity, though you have a window of up to 4 hours for many of these medications. Why 30 to 60 minutes? Because that's how long it takes for the medication to be absorbed and converted into its active form. After being broken down in the liver, it starts to inhibit PDE5, letting cGMP build up. If you're spontaneous, you can take it earlier. Some people take it 2 to 4 hours in advance, and still reap the benefits as long as you have some sexual stimulation within that time frame. Number 3, watch out for a high-fat meal. A greasy, heavy meal can delay the absorption of certain ED medications, especially sildenafil. When your stomach is busy digesting fatty foods, it slows down how quickly the medication can move into your bloodstream. Not everyone notices a huge difference, but if you're finding the pills less effective and you've eaten a big steak with fries, consider trying them on a lighter meal or an empty stomach next time. Number 4, keep an eye on your alcohol intake. While a glass of wine might help you relax, excessive drinking can lead to what's commonly called whiskey dick, where alcohol reduces sensitivity and makes it harder to get or keep an erection. In addition, too much alcohol can exacerbate side effects such as dizziness or headaches when you're using PDE5 inhibitors. Your overall health affects your erection. Erectile dysfunction doesn't exist in a vacuum. It's often a symptom of broader health issues, particularly those affecting blood vessels. Common culprits include diabetes, high blood pressure, and high cholesterol. When you have these conditions, your blood vessels may be compromised, and it takes more effort or a higher dose of medication to achieve the desired outcome. In a pivotal study of 521 men with ED who underwent comprehensive lifestyle changes and medical management, 82% of them later succeeded with sildenafil. What did they change? They got help switching from blood pressure medications that worsen ED, like propranolol, to those that are less likely to interfere with erections. They treated issues like high cholesterol more aggressively. They either quit or significantly reduced smoking, a well-known contributor to vascular problems. They also limited alcohol intake to recommended guidelines. Combined, these steps made a notable difference in how responsive they were to ED pills. Beyond medication tweaks, addressing lifestyle factors is paramount for long-term success. If you smoke, consider a smoking cessation program. If you have uncontrolled high blood sugar, talk to your healthcare provider about a diabetic management plan that might include dietary counseling or medication adjustments. If your cholesterol is high, a statin or other therapy might improve both your vascular health and sexual function. While this kind of lifestyle overhaul can feel daunting, the benefits go far beyond better erections. They include a healthier heart, clearer arteries, and potentially a longer lifespan. Alternatives and adjustments. Sometimes, despite your best efforts, one type of medication just won't cut it. That doesn't mean you're out of luck. If sildenafil isn't working for you, it might be time to discuss Tadalafil with your doctor. Tadalafil has a longer half-life, remaining effective for up to 36 hours, which is why some men prefer it. This longer duration can allow for more spontaneity. Others might do better on a daily low dose of Tadalafil, which helps maintain a steady level in the body. If PDE5 inhibitors truly aren't an option, perhaps due to side effects or interactions with nitrates used to treat certain heart conditions, your doctor may recommend alternatives like vacuum erection devices, penile injections, or even surgical implants, depending on your particular situation and needs. Speak up. Communication with your healthcare provider. It can be embarrassing to discuss intimate issues, but it's essential if you want to find the best treatment plan. In a survey of more than 1,600 primary care doctors, fewer than half routinely ask their patients about ED. That means the burden often falls on you to bring it up. If your current dose isn't working, or the medication causes side effects like headaches, flushing, or nasal congestion, let your provider know. The solutions can be simple. Maybe you need a lower or higher dose, a different PDE5 inhibitor, or additional tests to rule out underlying health issues such as hormone imbalances. For instance, low testosterone can contribute to ED, and if your levels are below what's typical for your age, testosterone replacement therapy might be worth exploring. If your doctor doesn't have extensive experience with ED, ask for a referral to a urologist, someone who specializes in the urinary tract and male reproductive system. Why you shouldn't quit after a few tries. There's real data backing up the idea that you should give it multiple tries, ideally at least 8, before you decide that PDE5 inhibitors just won't work for you. Performance anxiety, stress, or incorrect timing can each derail your experience. You might be nervous about how your partner will react, or fearful of side effects. Each subsequent time you use the medication, you learn more about how your body responds. You might realize you need to take it earlier, eat a lighter meal, or set a calmer environment to reduce anxiety. Over time, you also become more comfortable with the idea of using medication, which can lessen any emotional barriers. Looking beyond medication, a holistic approach. If you've tried all the adjustments, like waiting the right amount of time, optimizing your dosage, making healthy lifestyle changes, and you're still not seeing results, it might be time to explore the mental or emotional aspects of sexual health. Stress, depression, and relationship issues can all interfere with arousal and performance. A counselor or therapist trained in sexual health can help you and your partner navigate these concerns in a confidential, supportive space. Mind-body techniques like mindfulness or breathing exercises may also reduce stress and let you focus more on sensation than on performance pressure. Additionally, don't overlook the simple power of open communication with your partner. Discussing concerns, preferences, and anxieties about sexual intimacy can help relieve tension. It's easier to feel in the mood when you know you have a supportive partner who understands what you're going through. You can even explore forms of intimacy that don't rely solely on penetrative intercourse, easing performance pressure, while still fostering a deep physical and emotional connection. Final thoughts and next steps. Erectile dysfunction can feel isolating and frustrating, but the experience is more common than you might think. If ED pills haven't worked for you yet, don't lose hope. Review how you're taking them. Are you timing the dose correctly, avoiding high-fat meals, and ensuring you're sufficiently aroused? Check in on your overall health. Are there conditions like diabetes or high cholesterol that you can optimize? Are you on medications that could be switched for more ED-friendly alternatives? Talk openly with a healthcare provider who understands this condition well. Sometimes, just a tweak in dosage or routine is all you need. You also don't have to go it alone. If performance anxiety or relationship worries are adding stress, consider speaking with a mental health professional. A balanced approach that addresses physical, emotional, and relationship factors can make a profound difference. Think of it as part of a broader journey toward better health and well-being. If you've been on a lower dose, ask your doctor if a higher dose might be appropriate. If you haven't tried Tadalafil yet, inquire whether its longer window of efficacy might suit your lifestyle better. And if oral pills aren't a great fit, don't hesitate to explore other safe, medically approved ED treatments. Ultimately, the goal is to find a solution that works with your body and your life. If you haven't subscribed to our channel yet, I'd love for you to hit that subscribe button and tap the notification bell so you never miss our latest updates. Your support means the world to us. If you find this video helpful, please give it a thumbs up. It really helps share our message with a wider audience. I'm excited to hear your thoughts on today's topic. If you enjoyed the content, type yes in the comments below. If it didn't resonate with you, let me know by typing no. Your feedback is incredibly valuable and helps me craft videos that better suit your interests. How have you tackled ED challenges so far? And what's one strategy you learned today that you're excited to try? As always, remember to look after your overall health, physically, mentally, and emotionally, because you are worth it. Sexual wellness is just one part of a bigger picture, and taking care of yourself holistically can lead to better outcomes in the bedroom and beyond. Thank you for joining this discussion, and I look forward to hearing your experiences and questions. This content is for informational purposes and should not replace professional medical advice. Always consult a healthcare provider for personalized recommendations, especially if you have underlying health conditions or concerns. Let's keep the conversation going toward healthier, happier, and more fulfilling intimate experiences for everyone.